Well, my treatment philosophy is actually quite different from, I think, what is the customary experience of most patients. First of all, I actually use the term client more often than I do patient. And the reason for that is in the areas of my expertise, we actually engage in what I consider a true partnership, that is an alignment of the physician with the patient to go through a discovery process and trying to find out, what are the problems, identify the causes of those problems, and then sort of together come up with a treatment approach which will be most effective. My expertise is in the treatment of mood and anxiety disorders, so conditions such as bipolar illness, panic disorder, but it's really a subspecialty area that I focus much of my effort on, and this is in the area where we're only one of 2 or 3 programs in the country that you can obtain a comprehensive evaluation, and that is in the areas of sleep and sleep disorders that are commonly associated with anxiety disorders. We focus on different types of disorders that are associated with abrupt, extraordinarily fearful arousals from sleep. So an example of that is that we're very, very interested in a condition called sleep paralysis. And sleep paralysis is a syndrome where a person, as I mentioned, is either going into or coming out of sleep and is fully aware of their surroundings and circumstances, but is unable to move. They're in a state of paralysis, and that is an extraordinarily frightening experience for those individuals. In fact, people with this condition, again referred to as sleep paralysis, are often misdiagnosed by other healthcare professionals as a psychiatric or psychotic disorder. And these are not psychiatric conditions. These are actually, sleep paralysis is a condition that's exclusively related to these transitions into and out of sleep. It's a sleep problem, not a psychiatric problem. Well, there are a number of reasons for selecting MUSC. One is across all of the medical disciplines is a focus on the whole patient, and not only the patient, but the patient's family. And so you get a comprehensive treatment approach that's developed in partnership with the client and his or her family. So it's the type of place that I would recommend for my own loved ones. In my area of expertise, you really don't have much of a choice. So in my area, there are only 2 or 3 programs in the entire world where a person can seek an evaluation and treatment for the problems that I specialize in. In many of these sleep disorders, so recurrent nightmares, sleep paralysis, narcolepsy, which is another sleep condition that is associated with people having sudden muscle weakness while they're awake, because what's happening is they're having an intrusion of a certain type of sleep stage called rapid eye movement sleep, which is normally associated with paralysis. And individuals with extreme forms of narcolepsy will suddenly become very sleepy, become weak, and the extreme forms may actually collapse to the ground. And so we are studying in our laboratory, using a variety of different animal models, the causes of these different types of sleep conditions. And as I mentioned, we're one of the few places in the world that can actually diagnose and develop a comprehensive treatment plan for these conditions. So we literally are making things change, both in ways that will improve the treatment of citizens throughout the United States, but very much on a one-on-one basis.